Hey everyone, I am here with Dr. Kim again for our segment of Ask the Vet, and today we are talking about heartworm. So, Dr. Kim, what is heartworm and how do we know a dog is heartworm positive?
Yeah, so heartworm is a parasitic worm that dogs will get infected with if they are bitten by a mosquito that's carrying the infection. They get infected with the larval stages of the worm, and then once those worms are in the body, they'll start to mature, and the adult worms will eventually migrate to the big blood vessels that are going to come off of the heart and go to the lungs. As you might be able to imagine, that's not a great place to keep worms. So having those worms there can cause a lot of problems. It causes damage to those blood vessels, it's going to damage the lungs. Eventually, as that damage builds up, the blood pressure in the lungs is going to start to go up. That makes the heart have to work harder, and basically heart failure ends up being what eventually happens if this infection goes on for long enough. The more surprising thing to know might be that even though all of this is going on, dogs with the infection can be asymptomatic for a really long time. So generally we don't find out about it unless we do screening blood tests. And what those blood tests check for is they are checking for a substance that's produced by specifically the adult female worms. And that's important to know because it's the adult female worms that we're able to detect the presence of. There's kind of a lag time between when the dog gets infected and when we're able to tell that they have the infection, and that lag time is usually around 7 months.
So, Capone is heartworm positive here for adoption at ACS. How is heartworm treated?
Yeah, so treating for heartworm is a little bit of a long and complicated process, and there's a couple reasons for that. One of them is that we unfortunately do not have any one medication that's going to kill all of the life stages of the worm. So in order to make sure that we've killed them all and he's really going to be cleared of that infection, we have to use a combination of drugs. So that it ends up involving an antibiotic called doxycycline, which doesn't actually kill the worms themselves. What that's doing is it's killing a bacteria that lives inside the worms, and the worms need that bacteria to be healthy and to reproduce. So by killing that bacteria, we're making it easier for us to kill the worms with the other medications we're going to be using. And that includes heartworm preventatives, which are what's going to kill the younger larval stages of the worm. And then kind of the main part of treatment is a couple of injections that they get right in the muscles on their back. The medication we inject there is what's going to kill the actual adult worms, so that's called the adulticide. The other reason that heartworm treatment is complicated is because there's some fairly significant risks involved. I already mentioned that those worms are living in major blood vessels by the heart and lungs. It's not a good place to have live worms. It's also not a good place to have dead worms. So once we give them that adulticide injection and the worms start dying, they can have complications. There's a lot of inflammation that's associated with those dying worms, and they can even block off some of the blood vessels in the lungs. And depending on how major a blood vessel gets blocked off, that can end up being a life-threatening emergency. So there are some things that we do to try to keep down the risk of those side effects. The biggest one is restricting their activity. So Capone here is not allowed to go on any walks right now because he's still recovering from treatment. And there's a very strong correlation between dogs that are too active during the treatment period and immediately after the treatment period and having more of those complications. So we try to keep them as quiet as possible. We do also put them on anti-inflammatory medications to tamp down that inflammation and again make those side effects less likely to occur. In an ideal setting where we're treating a dog that's got an owner and is in a home, we also will spread a lot of these treatments out over the course of several months because that protocol has the lowest risk of side effects. But for Capone and our other shelter dogs, it's not ideal to make them have to sit around in the shelter for several months while we're doing all of these treatments, so we have kind of a more compressed version of the treatment protocol that we do. It does give them a slightly higher risk for side effects, but it also means that they have a chance to get out of here a lot sooner, which is overall a lot better for their physical and their mental health. So we think that's a good trade-off for them.
Once we've treated Capone or any dog for heartworm, is it a chronic condition or it's treated and it's done? Is this a lifelong condition?
So once they've successfully been treated for heartworm, those worms are gone. They're not going to be infected with it for life, and there's not really any chronic medications that they need to be on or any kind of chronic treatment. Some of the damage that those worms do in the lungs is permanent damage, so it's technically possible they could have some side effects from that, lifelong. Most of the dogs that we see, though, they're asymptomatic before treatment, they're asymptomatic after treatment. We don't see any effect from it, and they go on to live very normal lives.
So you adopt Capone. Is there anything special with an adopted dog that has heartworm that we need to think about or talk to our adopters about?
Depends a little bit on when you adopt them compared to when they were treated. So if they were treated pretty recently at the time that you adopt them, they may still be on those anti-inflammatory medications I talked about. They may still be on exercise restriction like Capone is right now. If you adopt them after that time period, then probably the only thing you're going to have to do is be careful to keep them on heartworm prevention. You need to stay on that until 9 months after they did the adulticide portion of their treatment. The reason for that is it takes about 9 months for that substance we're looking for to test for heartworm to be cleared from their system once all of the worms are gone. So that 9 months is really kind of the earliest that if they're negative at that point, we know we've really cleared the infection. So up until then, there could be a chance that there are some worms that survived. We want to keep them on the heartworm prevention so those worms can't mature and keep the infection going.
Can my dog that's here get infected with heartworm, even if they've never been out of the state?
So yes, that is absolutely possible. We oftentimes think of heartworm as an issue down south because it's a lot more prevalent there, but we do have it in our area as well. It's definitely possible for dogs to get infected locally. So for that reason, if you do have a dog, we do recommend keeping them on heartworm prevention. Most of our heartworm preventatives are a flavored chewable tablet that they get once a month. So a lot of dogs think it's a treat. It's usually not a hardship to have them on it. And it's definitely a lot easier to prevent heartworm disease than it is to treat it. So if you've got a dog, we recommend having them on it. And as an added side benefit, they do also treat for most of the common intestinal parasites that we have around here. So you'll be getting them some deworming once a month too.